A lot has changed since the NHS was established in 1948. In response to this, the NHS has published its plan for the next 10 years. This includes increased funding, more use of digital technology, and closer work between health and social care to help people stay healthy and deliver better care to people. So, what does this mean for Wirral? Wirral will receive extra funding, but there are existing challenges. These challenges include increasing demand on our health and care services, an ageing population, and variations in the health outcomes across communities, including a 10-year life expectancy gap. Change is needed if we're to maintain the quality of care and a positive patient experience. NHS organisations, GP practices and Wirral Council have come together to form the Healthy Wirral Partnership. This partnership is committed to act as one to transform our local health and care system. This means transforming clinical services to provide effective, high-quality care which is flexible and able to adapt to the changing future needs of our population. Making our services more joined up to avoid delays which put pressure on local services. Helping people lead healthier lives and recognising that illness is not the only cause for people becoming unwell. For example, poor housing and those living in isolation. This will result in a financially sustainable health and care system that provides more effective, high-quality services, ensuring that everyone in Wirral has the chance to live a healthier life. How will we do this? We are introducing place-based care. Place-based care is a new way to plan and deliver services. Some services will continue to be delivered in the same way, whilst others will be tailored around the needs of different communities and local neighbourhoods. Neighbourhoods are a key part of place-based care. 9 neighbourhoods have been established across Wirral, each serving a population of between 30 to 50,000 people. Each neighbourhood will have a local team made up of GP practices, mental health, social care, community and voluntary services. The teams will share responsibility for people in their neighbourhood, identifying those at the highest risk of becoming unwell, working with the person rather than just the medical needs, helping people stay independent and maintaining a good quality of life. Neighbourhoods present a unique opportunity for us to work together and put in place the services and support that people need to live longer and healthier lives.
The first thing children at Halton Lodge Primary School do is get moving. Each school day starts with a wake-up and shake-up session. Lots of fun with some serious health benefits. Halton's leading the way in health and well-being for schools. It's one of the few places in the country where everyone is signed up to its Healthy Schools programme, delivered by its integrated wellness service, supported by Health Lead Counsellor Marie Wright and tailored to each school's needs.
We've got every single school included and they're all very supportive of it. They all make time for the children to join in, and if we can work with children and help them to improve their health and well-being and to feel good about themselves and to feel active and to eat healthily, that then transmits to the home and the parents get interested and eventually it filters out into the community, and so we have a ripple effect and then everybody feels better.
So what does having a lot of sugar do for our bodies?
This school wanted their children to move more and eat more healthily. Today, there's a lesson on making the right drink choices.
Spot on, that's a really great answer, yes.
Taking part, children from the school sports council. It was set up to get children involved in making decisions on how to be active. One of those brought in an innovative approach to playtime, known as the Scrap Store Play Pod. It's an inclusive way to get everyone moving.
I like in it that there's this barrel like you can go in and you can like go around in it, and you have to move yourself to move that, and it's really fun. And now with the play pod you get to play with stuff and it just makes it more fun.
While fun is fundamental, health and well-being is the real target. Through its 5 ways to well-being, Halton Borough Council helps its schools to work not just on the body but the mind as well.
You feel the strength in your thigh.
This school's especially focused on the emotional health and well-being of the children here. They take part in yoga, mindfulness sessions, meditation and massage, all integrated into the school day.
We give the children strategies to cope with learning new spellings and times tables, And we just felt they need strategies to manage their mental health and their emotional well-being. And we just saw all the benefits of it and decided to, as much as possible, get it into the timetable.
Once we've done it, the classroom becomes quieter, which makes it easier to concentrate. I feel like free, so like if I have any worries on my mind, they like go away in a way.
And the evidence backs up its success.
We've seen an improvement in self-harm rates. We've seen more children getting active, and we've also got more parents getting active. We're seeing improvement in school, and we're also seeing improvement at home.
My name's Karen Nolan and I coordinate Live and Well Sefton, and I work for Sefton CVS. Okay, Sefton CVS have been coordinating the Live and Well Sefton partnership for the last 2.5 years. In that time we've been very successful in developing our brand. So our new Live and Well Sefton model that we're proposing is going to mirror the council's new locality model and also mirror the new structure within Sefton CVS. And we're going to have lead partners in the North, Central and South localities, those being Brighter Living Partnerships, Feel Good Factory and May Logan Centre. These partners have been part of Live and Well Sefton since it started in July 2016. So within each of the localities we're going to have a universal offer which will include GP-based support, universal consultations, social prescribing support, behaviour change and goal setting, and also community NHS health checks. The benefit of having these partners lead in those localities is that they've been working there for a number of years. They know the communities that they're there to support. They are recognised brands. The communities trust those organisations. So that universal offer is really going to be the backbone of the whole service. Sitting underneath the universal offer is the thematic support. So over the last 2.5 years, we've identified where the gaps are in the existing support and where perhaps more input is required to build on the offer that's already available. Now, social isolation remains a real issue across the borough, so we're delighted that Community Connectors are going to be part of Live and Well Sefton, really helping us enhance the offer and reduce the impact of social isolation and loneliness across all age groups, not just older people.
My name is Brian Dorr. I'm the CEO of Safer Generation, and we're happy to be a partner of the Live and Well Sefton programme.
Hello, we are Woodvale and Ainsdale Community Association and we are happy to be a partner of Living Well Sefton.
Hello, my name's Colin Avery. I'm the Administrator of Southport Food Bank and we're glad to be a partner of the Living Well Sefton.
Hi, I'm Helen and I work in the Knowsley Integrated Community Frailty Team. The service involves health and social care partners across Knowsley working together to better meet the needs of people aged 65 and over and help prevent unnecessary hospital admissions. The Integrated Community Frailty Team is a partnership between North West Boroughs Healthcare NHS Foundation Trust, Knowsley Council, Knowsley Clinical Commissioning Group, North West Ambulance Service, St Helens and Knowsley Teaching Hospitals NHS Foundation Trust and Aintree University Hospital NHS Foundation Trust. Together, we have redesigned our services so we can offer a rapid 2-hour response when older people are at risk of hospital admission. The team is led by community matrons who have specialist skills in supporting adults with frailty and is supported by doctors, nurses, therapists, social care, pharmacists and specialist falls assessors. By having different health and social care professionals working together, it means we can ensure a care package is put in place which meets all of the patient's needs. By bringing care closer to home, we are also relieving pressure on the whole of the local healthcare system.
My name is Neville Treppers. I'm 81 years old. I feel that if I'd have had more home care, I wouldn't have gone into hospital on several occasions. Last year I spent 3 months in Warrington Hospital and then 5 weeks in Padgett House, and I had to be taught to walk again because I'd spent 3 months in bed. and I still have problems with mobility, and I feel that if I'd have had more earlier care, I probably would not have spent so much time in hospital. As I have cellulitis, on 2 occasions I have had the IV community system, and that's, I feel, stopped me from going in hospital on those occasions. And I feel if that was more readily available, I wouldn't be using your bed up in hospital. Well, the most obvious one is kept me out of hospital more so than, as I say, I've been in 5 times, and if the community system had been more involved, I wouldn't have been in all that time. So, you know, I do feel, I feel that I'm happier at home, and
Hello and welcome to Cheshire Place. I'm Mark Palethorpe. I'm the Executive Director of People at Cheshire Council, and I'm also really proud to be the place lead for our system. Now, it's obvious, as I'm a local government person, to you all to see that having local government at the heart of everything that we do is really, really important, because we recognise as a system, and if you look at our plan on page 9, it talks about those health outcomes and how they're achieved, and the issues around inequalities are sitting outside of those kind of clinical inputs. So the clinical element of this is really, really important to get that offer right and to have it focused on what is going to help our population, but those wider determinants around lifestyle, around environment, around education, around housing, how much you earn, what sort of job you have, those sort of things are going to influence those health outcomes. So it's really important that we work together as local government and our NHS partners to deliver on those things. So our place is really focused on, okay, we've got the bringing together of the infrastructure, whether it's ICPs or ICSs, but delivering on what we said we would do and making it a sustainable system for the future. And when I say system, this is about strong partnership. This is about integration, parity of integration, and also making sure that we take the benefits of all of that together, and that one part of the system doesn't benefit against another part of the system. So that's really important. We have some real sort of challenging conversations in Cheshire East, but that's the right thing to do, because it's about how do we get the best for our population. So
over recent months here in Liverpool, all of the public sector partners have been working together to develop a new plan for the city, a new city plan. And a key part of that is the One Liverpool plan for improving health and care outcomes across the whole of Liverpool and tackling health inequality at the same time. This is very much about a transformation of the whole system and a shift to a whole population health model, which a lot of you will be familiar with. But this is really important as a key component of the whole city plan, not just in delivering significantly improved health outcomes, but also boosting productivity in our economy, helping to tackle deprivation and underlying issues that are holding back our communities and our families from achieving their full potential and living long and healthy and happy lives. So the health work that we do is really important just from a health perspective, but it makes a massive difference in terms of those wider issues that really determine the quality of life for people in Liverpool.
Hello and welcome to Cheshire West, our place. Our place has its people at the centre. Wrapped around them are our local services such as GP practices and care homes, the local authority and other NHS organisations. In Cheshire West, we focus on our 9 care communities that are made up of everything that help people be the best they can be. I'm now going to hand over to one of our clinical directors, Rebecca Banks, who, pre-COVID, recorded this piece about one of the projects we now have in our place.
Hello, my name's Rebecca. I'm a GP in Chester and I would like to tell you about some work being done by the Cheshire West Integrated Care Partnership. This is a collaboration of health and care providers who are working together to provide joined up care for the people of Cheshire West. One of the projects we're focusing on at the moment is to look at the top 50 most frequent attenders at A&E and general practice, and these patients have been identified using a system called ClickView. We have a project manager starting in April who is going to work directly with these patients and also with the agencies who are involved in their lives currently. We hope that by really addressing their issues, we will see a reduction in their use of GP appointments and A&E attendances. The first meeting brought together a wide range of people who would not otherwise have crossed paths normally. For example, we learnt that the police have dedicated mental health officers who in turn have access to a wide range of community support that would really be of benefit with this work. We're going to use all the information that we shared to support the project manager going forward. By providing the vehicle to bring all the key stakeholders together in one room, we've really been able to see the benefits that the ICP can make to our patients.
Thank you for listening. I hope you enjoyed that small insight into Cheshire West, our place.
The local authority commissioned a piece of work as to how the public sector organisations, with the lead social landlord and together with the third and voluntary sector, could come together and work in genuine collaboration to maximise what resources we did have. We recognised by carrying on as we were, each individual organisation was facing an increasing deficit. We also recognised that if any one organisation fell over, it would impact on all the others in St Helens, so if we didn't pull together, we would all be severely affected. It concentrated minds. But there was a real energy and will to make it happen, and thus the People's Board began its journey.
I first lost my dad in June 2016 and then I lost my mum in April 2017. A lot of the meaning in my life was gone because I was caring for my mum at the time. I felt like I had no use or no meaning. I was basically not wanting to be here or be awake a lot of the time. I was diagnosed with nerve damage caused by malnutrition. I wasn't eating, I was just living basically upstairs, so that the bills on the house were just getting up and up and up, and then when I was in hospital they went round and just emptied the house. My case shows that when people are working independently and don't liaise with other people, people can slip through the nets. So it definitely helps when you've got the bed coordinator speaking to your physiotherapist speaking to your psychiatric nurse, and everyone being in sync and working together. They've basically said to me, we'll do all the worrying for you, you just concentrate on getting better. So I just want to say thank you, I really mean it.